It is the time that was posted for our Board of Health meeting. This is December the 6th, 2024. We are at the 1415 Melody Lane, Building A in the large conference room. We do have several people online, and as I call this to order, I'd like to have each one of you introduce yourself so that we can have your name on the record. So, Susan, I guess we can start with you since we know you're there.
Yeah, I'm Susan Warren, a member of the board, and glad to be here by phone at least. A retired, let's see, from the hospital board and the foundation board and as an attorney. Okay, I think that's it.
Thanks, Susan.
You're
Next.
welcome.
Kim?
Good morning. My name is Kimberly Mitchell, and I'm with Cochise County Health and Social Services as your Public Health Preparedness Coordinator.
Good.
Myra?
Good morning. My name is Myra Ibarra. I'm the Division Director for Clinical Services.
Axel?
Hi, good morning. My name is Axel Lopez, and I'm the one of the epidemiologists for Cochise County, working under the PET division.
Dr. McLaughlin?
Yeah, good morning. My name is Dr. Eric McLaughlin, and I serve as Cochise County Public Health Medical Director. Thank you.
And Tomini?
Good morning. My name is Tomini Allen. I am the Immunizations Coordinator for the Clinical Services Division and one of the public health nurses in Sierra Vista.
And Belle?
Good morning. My name is Belvet Elsuhag. I serve as the Cochise County Public Fiduciary.
What a cool name.
And at the table, we have, let's start with the board member.
I'm Evelyn Whitmer, and I'm with the University of Arizona Cooperative Extension.
I'm Mike Hewlett, and I'm the Deputy Health Director for Cochise County.
My name is Taryn Beck. I'm the Administrative Assistant for the Health Department.
Good morning. I'm Suzanne Hagel. I'm the Prevention Services Division Director.
Thank you. And if there are any other board members that choose to join at any particular point in time, just speak up and we'll announce you and put you on the record. I think the second thing on our agenda is ADHS site visit. So
That's me.
tell us about that.
Okay, so earlier last month, we had the leadership, including the director, the deputy director from Arizona Department of Health, come down. We met with them for a couple of hours. It was a good meeting. There were several things that were discussed. The primary things that we talked about were obviously internal things to the health department about grants and how they were set up and how they get invoiced, et cetera, et cetera. But we did have a really good discussion about the challenges that rural counties face, particularly in funding and in distances that we have to travel to accomplish things. And it's interesting when folks come down from, obviously, from Phoenix, that they don't have a concept of what a big space is and how far we have to go to provide certain services. So it was a good discussion about that. And then Barb talked about workforce development and how we're working cross-border with Mexico on both workforce development and some other projects as far as infectious disease and things like that. So it was a really productive meeting. They took a lot of our stuff back. We'll see if they actually do anything with it. The primary thing that I tried to get across to them was that grant funding in its entirety across the country, particularly in public health, is based on population, right? So the more population you have, the larger amount of the grant funding you get. And I told them that's backwards. They already have a huge tax base because they've got all these people. They need to relook at how they're doling out the money. The majority, the bulk of the money should be going to the smaller counties, smaller tax bases, so that, you know, they can do things, whereas Maricopa is going to have money. It doesn't matter if they get federal dollars or not. They're always going to have money. So that was really what we tried to impress upon. Any questions?
No, just an observation. I was at one of the border health meetings, and one thing that I thought was very interesting and a concept that I'm hoping that we're pursuing diligently is the fact of the medical professionals in Agua Prieta or Sonora are growing in number, but they can't participate in our economy because of the restrictions by the state. And so I think that that's something that we need to move forward and try to get certification possibilities. I know since my husband is in a facility now, and many of the young people that are working there, I have not asked them if they are from Mexico, but they appear to be. So they can work as a CNA or, that concept, but they can't really be part of the economy and the health structure like I would like for them to be. And so I think that we can't overlook that as a future concept that we need to pursue. It's good for them, it's good for us, because we can't seem to produce enough on our own. And we have a community across the line that's over 100,000 people, and they have training facilities, etc. So we need to partner and see if we can't move that forward. So in the future, when you work with the state, of course, that's where certification takes place. So we need to have some kind of a ladder and make them so that they can be a part of the medical community in reality. That's just something that I've noticed, and I thought, I'd bring it to your attention. Okay, thank you.
I have a thing that I know that, because a lot of times I get invited to stuff in Phoenix, and one of the things that I push is that Phoenix and the bigger cities already have infrastructure. And so it takes more funding for us. We have people out in communities that can't get to a dentist or can't get to a service. And so it takes more money for them to be able to get to these places. So that's kind of what I focus on when I have those meetings up in Phoenix. But yeah, they don't get it. I've been saying it for years, but yeah.
They live
So
and
keep
don't
doing
understand
it.
it.
Yeah.
Well,
Keep at it.
I think in the whole country, there's been the shift from agrarian, which is rural, to urban. And so many of our leaders are only urban. And so that concept is not a part of their life. It's kind of like after the war, when the farmers moved to the city and took, those jobs that were available to them after their training, they left the farm. So we don't have little farms anymore. And so I guess what I'm saying is we need to stop that slide, because rural living is a choice for many people, and we want to keep it a choice, not make it so that they have to move so that they can get the services that they need at a particular time in their life.
And I think anybody in this room or anybody online will be able to say that is our director's number one priority.
Right.
Is workforce development, keeping our people here, keeping our money here, which Tara will talk about here a little bit later.
Good. All right, prevention highlights, Suzanne, I'm sorry.
Again, my name is Suzanne, and I am here to talk about our highlights highlights of 2024. Prevention services is one of 7 divisions within the health department, and we make up about 30% of the department. Within prevention services, we have health promotion, which has the several smaller programs underneath that.
This is Lenny Cope. I'm entering the meeting by telephone. I can't get in on the link.
Good morning, Lanny.
Good morning.
Our other programs are Health Start, the home visiting program, overdose prevention, which also oversees the fatality review teams, and we also have WIC, Women, Infants, and Children's program. So our health promotion program is made up of several prevention education programs that include chronic disease prevention, tobacco prevention, teen health, and worksite wellness. The highlights for chronic disease prevention, this year alone, that health educator provided 67 free presentations to the community at various locations throughout the county. And those preventions consisted of brain health, hypertension, healthy eating presentations. In total, he saw just over 1,000 attendees at those meetings.
That's one person?
One person.
Yay.
Yeah. He was also featured on the radio station K101, and he did some educational talks through that radio station. And just recently, he was featured in a newspaper article, and he was at one of his presentations at that time. Tobacco prevention education. The reason this is so significant is because this that position was vacant for over a year, and we hired somebody in in August, and she had to she just jumped right in and took over. She built partnerships all over again, and then she was able to deliver 10 Ashline trainings with 93 healthcare professionals. She delivered 20 anti-vaping and tobacco presentations to 1,600 students just this August up until today. And those tobacco prevention presentations were given to junior high and high school students.
You know where?
Throughout the county, she's been to Bowie, Douglas, Bisbee, Sierra Vista, so she goes all over. And she's still trying to build up partnerships and
I've seen her around, so she's out there.
Good.
I think it's a good point to be made with Suzanne's team, the prevention folks, and the health department is working really hard on getting to our grossly underserved communities. The Bowies, the San Simones, the Winchester, those places, and we are making pretty good headway.
Well, when I see the numbers, and that's why I was asking you, where, because Bowie, you might get 3 people,
Right.
but those 3 people really need it, so yeah.
So then we have our teen health education program, and we have 2 health educators in that program, and they deliver a 10 to 12-week curriculum that is evidence-based that's provided by ADHS. And to date, we've seen just over 1,100 students. That's junior high and high school students. And recently, we were recognized by ADHS. We are the 3rd highest county that has reached that many students. So just right under Maricopa and Pima comes Cochise County. So we've seen a lot of students this year. And since July, we were trained in the youth mental health first aid. So 2 of our health educators were trained, and we're required to give at least 6 trainings to keep up our certification. We've already given 3, and we already have the other 3 booked for this coming year. Worksite and school wellness. This program goes out into the community, and they offer assistance to work sites and schools to implement employee wellness programs for their staff. In addition to that, we are starting the breast-friendly businesses. We were doing that before COVID, and then it kind of fell apart, so she's trying to rebuild that. But what that is implementing policies so that businesses would have a breast-friendly room, either for their employees and for clients maybe that's coming in. We're starting to do that again here in this department. We're working on setting up an office or space here in Bisbee and in Douglas. And it just provides a quiet, private space for moms to go in and breastfeed if needed.
Are you doing that countywide, or is that just for the health department because Regan and Jacob already all. Okay, they're working with you. So we partner with them.
Awesome. And we're trying to get back out into the business. Yeah. And then Cochise County, we received the Platinum Award through Arizona Healthy Worksite program. We've received that award. This is the 7th year in a row. And we partner with our county human resources. And it's a process where we have to collect data, submit an application, and go through this whole process before we're actually awarded. So we are doing that internally, and we're also working with work sites throughout the county that are going through this award process as well. Some of the other programs that we worked with, or excuse me, the other work sites are as Canyon Vista, Benson Hospital, Northern Community, Northern Cochise, City of Douglas, and Chiricahua. So they've all been awarded as well. And that's because of our health educator that gets out there and promotes this program. One of our new pilot projects was Sunwise Safety. And that's a fairly small program, but it was something that we decided or thought that it was important just to educate people on that, provide resources. We did presentations and we handed out such things. So that's something new. And then we built partnership with 6 school districts. We sit in on their school health advisory committees and help them develop policy for their students and employees, wellness policy. And we have our Health Start Home Visiting program. This program is a evidence-based curriculum where health educators provide nutrition and family safety in the homes. Again, this is countywide. Those health educators go out to Elfrida, Wilcox, of course, Bisbee, Douglas, Sarah Vista, and they see families in their homes. And just recently, Letty Aparicio, she is our administrative manager for that program, and she was recognized at ADHS and received the Health Start Community Catalyst Award. And she was the only administrative manager throughout the state that received that award. So she's very dedicated to that program. She started out as a health educator herself. We have built partnership with Chiricahua Pediatric Center. We worked with Dr. Holzberg at Chiricahua and developed a referral system. He actually came to us and he said, my patients really need a program like this. How can we partner and how can we build a referral system? So that referral process is in place. And so we get a lot of his patients from Chiricahua. That team just recently attended the Strong Families Conference in Phoenix, and they were asked to present on how our program works in Cochise County, being that it's a rural community. Overdose prevention. This program aims to expand services to reduce opioid overdose, and we strive to improve outcomes for people who use drugs in recovery. Kendra Allen, the program manager here, she's really developed the naloxone program, the distribution program, and you could see the numbers, kits that we distribute. So from 2021, 680, and up to today, just over 4,600 kits that we distribute. So we receive free naloxone from the state, and so we're kind of like the hub. We distribute to anybody that wants it. We partner with Cochise Harm Reduction, law enforcement, medical facilities, and so they'll come to us and ask for this naloxone as well as just individual kits if we're out at an event. We've also set up here at the county, at each of the 5 sites, somebody can come in and pick up naloxone at the counter, but we ask them to watch a naloxone education, like just how to use naloxone. So it's just like a 5-minute video that we ask them to watch before they take the kit. So just within the past year, we have about 27 naloxone access points throughout the county. So she's really partnered with these organizations. So we have 27 places that people can get naloxone from. We also have the Link to Care transport program. We have a public health social worker that works at our county jail. And we've developed a system so when people are being released from jail and they are going to a treatment facility, we could provide transports from here to that facility. And sometimes it's in Phoenix, sometimes it's in Tucson. And then that person may even call us when their treatment is over and ask, can you pick us up, bring us back to Cochise County? And those people that stay in the program, we can provide transports to doctor's appointments, the grocery store, AA meetings, probation meetings, things like that. To date, we've provided 75 transports. And so that is kind of slow moving, but it's finally getting off the ground. And then the established partnership with Cochise Harm Reduction. We've worked with them to collect data, and she's presented this data, or Lou at Cochise Harm Reduction, with a grant that she's received. So we were able to partner with that to collect data that she needed there. This is a little daunting. It's not a highlight, but this is part of what the fatality review teams do. The teams are comprised of behavioral health providers, medical health providers, pharmacists, law enforcement, and so on. Rachel Rawlings is our epidemiologist that runs those teams. She compiles all the data, puts together the summaries, and then they have a review team, and they meet separately, and they probably meet at least 4 times a year, or both overdose and for the suicide team. They come together and they provide prevention-based recommendations for possible future programming, and then that information is sent back to ADHS. Just some data, suicide cases, they've kind of stayed consistent, but we've already received 2024 data, and those, we have more than 35 cases.
Is that cases or those deaths?
Yes.
That deaths.
Just in Cochise County? Just in Cochise County. How does that compare to like statewide?
Statewide, we're lower. I don't have the exact figures, but I mean, for Cochise County, I think that's significant.
I'm surprised, actually. Surprised.
Yeah, no. So like I said, we have to work a year behind. So these are numbers that we've already completed and submitted the annual reports. Like I said, she has started to receive the 2024 cases, so she'll be working on those in next year. Okay, and then overdose. Again, that's kind of stayed about the same, but those are overdose cases, again, just in Cochise County. Fatalities. But we do have some highlights in this program, and I don't think we have a slide there, but when Rachel conducts these review teams, 2 people from ADHS sit in on those reviews. I received a call from someone at ADHS in that program, and they were very impressed with the way she developed the case summary and actually runs those meetings. And they provided us the opportunity, with additional funding, of course, to take over the Graham, Greenlee, and Santa Cruz review teams for suicide mortality. So effective July 1, we did decide to take that, and we received an additional $55,000 in that one grant. And then Rachel Rawlings just recently received her master's in public health, and she's working towards her doctorate degree now. So I hope she stays with us. And she's also been asked to present at several presentations, both at the state and local level. And finally, we have our WIC program. The WIC program just hit their 50th anniversary this year. This program provides nutritious food, nutrition education, and breastfeeding support to pregnant moms and breastfeeding moms, and we see children up until the age of 5 years. We recently partnered with an organization called Vitamin Angels, and it was kind of a partnership with WIC and Health Promotion. And we provided a breastfeeding workshop here in Cochise County on October 11th. And Dr. Audrey Buckland had collected data on specifically in Cochise County. And we focused on Latino expecting and postpartum moms, and we were trying to identify gaps in those areas and try to increase breastfeeding rates for that population. So that was a very beneficial workshop. We had about 25 attendees, and so we continue to work on those, that small focus groups after the workshop. And last year, with the state WIC program has a program that if you exceed caseload within 1 quarter, they will provide us with an additional $10,000 funding. We were able to do that it was the second quarter of fiscal year 24. And at that time we were down 2 health educators, but we still exceeded. And so they provided us with the additional $10,000. And this year for fiscal year 25, our caseload is set for just over 3,000 visits per month. So
How many caseloads do you? That's a lot of visits per month.
Let's see.
8 or 9 right now.
8 or 9. We're down 1, but
You guys are doing great.
They're busy.
Yeah.
So, and again, we've really tried to expand our services. We've been going out to WIC and Winchester Heights, partnering with the people out in Winchester Heights, and just within the last week, the last month, we've probably registered about 10 families just in Winchester Heights. So we're really working towards increasing our caseload again. And I think that's it.
Well,
Questions?
no questions, just a lot of compliments on each one of those departments. That's my idea of public health, is that we try to catch it before there's a problem.
Yep.
And so that department's always been important to me, that's the reason we have public health. It's not to fix people that are sick, it's to keep people from getting ill.
Correct. Yep.
And I really admire the partnerships that you have in the community, and, because I was like, oh, are you, and you're like, and we're partnering with, and so, yeah, great.
Anyone online have a question or a comment?
I'll just follow up with the wow, great job, Suzanne, and incredible outreach, and hats off to you and the caseworkers and all the work that you guys are doing out there. That's amazing.
Thank you. We have a lot of dedicated health educators in this program.
And we need to put your name on the record. I recognize your voice, and you're not on our record, so tell us who you are so we can put you on the record.
Oh, sorry, I thought you could see my face here on the screen. It's Seth.
I just have a quick comment, if that's okay.
Certainly, go ahead.
Yeah, this is Gary Karchner over at Benson Hospital. I'm always impressed when you get people together and start to talk about some of the opportunities. It's kind of those brainstorming sessions. Is there anything that's in place where, we could we can get together and kind of strategize and think about what can be done, because I feel like we're, like Cochise County, one of the real strong points of this area is, we do work well together when we get the opportunity to do that. But maybe if there's a time where we can sit down and brainstorm, we can see what other things that we could do.
Yeah, I'll definitely make a note of that. And then we can figure out a date and a time that we can all get together for that. Good idea.
That'd be great. You're welcome to have it here at the hospital. So.
Okay, thank you.
Any other comments before we move forward?
I'll just share real quick. I think you know this, Gary and Jason, for sure. We do get to connect and collaborate with the Board of Health at the monthly Benson Community Meeting. And that's where like some of the discussions have come out about congregate meal programs and, other project ideas. But that's just one person from the Board of Health. But I love the idea of a more robust conversation across across all of the programs that they offer.
Awesome. Thank you. Okay, Axel, you want to tell us about the H5N1 update?
All right, good morning again, it's Axel. I'll be giving a situational awareness update on what's happening with H5N1 throughout the country and also within Arizona. And I believe last time we met, we had a brief introduction onto what avian flu was. So let's start with Arizona. What's happening in the state? Good news is that there have been no human cases identified. And the CDC still considers the risk of infection low in the general public. The risk of infection, of course, starts rising with those populations that work directly with ill cattle and chicken. We did have a recent scare in November in Pinal County when staff started noticing chickens in an egg-producing establishment with symptoms consistent with avian flu. So the next day, they sent some samples to the state lab veterinarian, and sure thing, it came back positive for avian flu. And as a consequence, the facility had to conduct depopulation procedures, as well as activating the protocols to try and contain the spread of the infection. And about 800,000 chickens were affected in this outbreak in Pinal County. That's a lot of chicken. It's important to know that none of those eggs made it to the commercial supply, so it was caught in time. And the beauty of this incident was that the coordinated response between local, state, and federal agencies all came together towards a common goal of containing this outbreak. And then the second incident we've had in Arizona was in Maricopa County a few days after the first one, in November 21st. This affected backyard poultry. And again, the samples were sent to the state veterinarian and positive for avian flu. Switching species here, cattle is another commodity that can be affected, and some other states have reported outbreaks in cattle, both dairy and meat cattle. But Arizona has had none since we detected the outbreaks start picking up. And the economic consequence of this is that egg prices are anticipated to start rising since so many chickens were affected. Now, nationwide, there's been 58 human cases identified. Most of them were exposed to ill cattle in California. And then there's a few others that were exposed to ill poultry. And only 2 out of the 58 have no known exposures. So they're still trying to identify where they picked it up from. So the top 3 leading states reporting human cases are California, Washington, and Colorado. There's 4 other states that have 1 or 2 cases, which include Michigan, Missouri, Oregon, and Texas. Nationwide, all 50 states have reported outbreaks in birds. both wild and poultry. And 15 states have reported outbreaks in cattle. Two of our neighbors, Nevada and California, have had issues with cattle outbreaks, but none in Arizona so far. And so these 58 cases have recovered well. The clinical manifestation is you get respiratory symptoms consistent with flu, and also conjunctivitis is a telltale sign. All right, so what's being done to identify cases nationwide? Well, every year there's the flu program ran by the CDC where they get samples from representative areas in the United States. So for this year, there's been 61,000 samples of flu A received either at the state lab or CDC, and out of those 61,000 samples, only 2 have been positive for H5N1. And then there's another type of activity that's happening nationwide, which is the enhanced surveillance. This means that groups of interest are identified through CDC, state and local health departments to have a really good watch. This means the workers that come in contact frequently. So they identified about 8,700 individuals being exposed to ill animals. And out of those 8,700, 400 were tested because they at some point developed symptoms. And out of those 400, 56 came back positive for this specific subtype of flu, which is the H5N1. So I would like to put out a reminder that the burden of disease might be higher out there in the community, but not all the cases get identified. Public health is doing what it can, and hopefully this will stay relatively low risk as it's been observed so far. Now, that was it. If there's any questions or discussion, feel free to unmute yourself or put it in the chat.
Any questions from board members or anyone online?
I have to just say, I get your email, and I look at it and I send it out to different people, and so I appreciate that email that we get from you. And now I get to see face to face.
Okay, well, let's move on then. Tara, Keeping Care Local campaign.
Yes, so I'll tell you about this campaign on Barb's behalf. So we applied for and were the recipient of a grant from the Arizona Community Foundation of Cochise County. It was a $25,000 a $10,000 grant that will allow us to create an ad campaign for basically keeping care local. That's the idea. As we discussed earlier, we have a problem with not having enough jobs in our county in healthcare and then not having enough providers. And so this campaign is aimed at the community to let them know that healthcare in our county is competence healthcare. You will get the same quality of care as you will get if you go to Tucson or Phoenix for healthcare. We were able to partner with Benson Hospital, Canyon Vista Medical Center, Chiricahua, Copper Queen, and Northern Cochise Community Hospital, who each also provided funding for this campaign. So with the grant funding and the partnership funding, we're able to get an ad campaign from a company called Initium. And they do healthcare ad campaigns specifically in Cochise County, and we've used them for other ad campaigns too, but they focus specifically on healthcare and promoting all of the service providers that we have here in Cochise County. So if there's any questions, we can, we've been having meetings with the other providers. All at our last meeting, I know we had representatives from all of these hospitals, and we discussed where we want the ad campaign to go, but as of right now, we don't have any samples yet of what it's gonna look like.
Great idea.
Yeah, and the main focus is keeping the revenue here in Cochise County, so people don't have to leave, which is, it's always a financial burden when people have to drive to Tucson, because they might have to take the whole day from work. They might have family members that they have to pay for a babysitter, of course, the gas money, and then that revenue is leaving the county too, so it's just multiple different factors of why we want to keep that funding here.
I'm hoping that it will also alert the children of people who still live in the county that it isn't necessary for them to try to move their parents. Because that's a mindset of people who leave the county for jobs, et cetera, and are successful wherever they are, is that many times they feel like, oh, I've left my parents there and there's not medical care. So hopefully this campaign will start to allow everyone to understand that we do have medical care in Cochise County. But if it's so significant we can't take care of it, we know where to take them. So that's what I'm saying is that, that'll help, I think, not just the people who live here, but the relatives of those people who live here who won't always think that they have to move them, take them somewhere else. Thank you. Member concerns. Any of you have any other ideas? I know Dr. Carpenter mentioned about meetings to try to get more ideas on how we can move forward. Does anyone else have any further ideas or concerns?
Anne, I have a question. This is Susan Warren. I was wondering about the status of rabies in this county because I've seen a couple of reports of rabid foxes.
Yeah, we've had a couple of incidents with rabid animals. Most of them are skunks, but lately, during the last 2 weeks, we've had about 3 incidents with foxes out there in the Hereford, Huachuca City area. We've started a campaign to try and educate the public about the dangers with going out there in the wilderness and encountering an animal, handling animals, and what to do if you get exposed. Which is going to the ER and getting your care right away. Rabies has been picking up, and we're working closely with the state towards handling those exposures, as well as USDA and animal control officers.
Oh, thank you.
Yeah.
Kim, do you want to briefly talk about what you've done working with CCOM on how we're going to communicate to the first responders in rabies cases?
Yes, absolutely. So we did realize that there has been some those calls for animal bites and such come through the dispatch centers throughout Cochise County, which our main dispatch, or I should say CCOM, services a large area of the county. And then you have Benson Police Department and Douglas Police Department as well. So we made contact with them just recently and gave them some guidelines on how to figure out how to deal with the animal that they have been exposed with, who should be called, who should be notified, how these callers should get medical attention and seek medical attention, and what they should look forward to when they get that medical attention, what it looks like. So we did send that out to our dispatch centers, our public safety dispatch centers. So they also have a packet as well to guide them through those calls just in case they are unsure. And we also have physician provider packets that we send out, and that's been going on for a year or two now, and it's specific to our physicians that are attending these patients. And we also have been doing quite a bit of media out there for rabies for years now. So we really are trying to push it out, and we are trying we will be presenting and trying to get a different type of rabies meeting or committee going on so that we can involve our U.S. wildlife like our Arizona Game and Fish involved and our federal partners on the fort as well. So we can all come together and have a common picture and are able to discuss and all of those cases and how we should continue with our communications and notifications.
Thank you.
Great.
Good, thank you.
Sounds like we're trying to do what we can to at least react to the situation. We can't control it, but we have to react to it. Anyone else have a comment?
Definitely try our best.
I'll just jump in real quick. This is Sep again. We did have out in Pomerene last year a couple situations with rabies, no human bites. And I just want to say the response from the county and I think it was also a federal agency was very fast and very helpful. And they stayed in communication with us via text, email, phone calls, any questions we had. It was just a very high level of really good communication. So that's just from a public person's experience with this, and that was in 2023. And the other thing, and maybe this is already happening just as a suggestion, is really getting this communicated to all of the vets in Cochise County, just thinking of their interactions with cats and dogs and family pets and that crossover with wild animals and rabies.
Thank you, Seth. Any other comments? Well, as you all know, this is my last meeting. Okay.
So on behalf of, before you pick up that gavel, on behalf of Director Lang and the Cochise County Health and Social Services Department, we want to personally thank you for not only your service as the chairwoman for the County Board of Supervisors, but also the Board of Health. And we want to thank you for being a very strong champion for public health. Where you retire.
Thank you. I appreciate that.
Yeah.
I heard someone say something, but I didn't hear it. Oh, I see hands clapping. Thank you, whoever you are. I can't read the name. Anyway, this is my last Board of Health meeting, and my concern always has been for the health of people in Cochise County. Not only health-wise, financial-wise, I have enjoyed my years of public service with Cochise County, which even though it was 2 stints, it amounted to 24 years. And much of that time I was on the Board of Health, because that's always been a thought for me, is that if we don't have healthy communities, we don't have anything. So I'm hoping that you get someone who's really interested in health on the Board of Health. But if you don't, you need to remember that the people in the communities are the Board of Health. There's only one member from the Board of Supervisors that sits on this board. So you need to be strong in asking people in your community who have caring thoughts about health to consider being a member of the Board of Health, so that it can be moving forward. Most people have no idea of the amount of money that comes through state and federal agencies for health in Cochise County. It's not their taxpayer dollars that's paying for all of this. And so we need to get people who care to sit on the Board of Health. Having said that, this meeting is adjourned. You all have a great day. Thank you.